This is the second episode in a series of 4 episodes on managing spasticity triggers. The bladder is a muscle with a valve that stores urine. It does this by expanding to hold urine and contracting to void or empty. When the bladder is full, it sends a message to the brain and spinal cord. This message helps a person prepare to find a safe place to empty their bladder. Most people empty their bladder 4 to 6 times per day. If the message between the bladder, brain and spinal cord is disrupted, as in neurological disease, it can cause symptoms such as retention, frequency, infection or incontinence. People living with spasticity report that their spasms, clonus and stiffness often gets worse if they develop a bladder infection. Damage to the spinal cord or brain can cause problems with the bladder being able to store or void urine. Problems storing urine can cause symptoms of needing to go to the toilet very quickly with little warning, having to go to the toilet often, needing to pass urine frequently at night, and incontinence. Problems voiding urine can cause hesitancy when starting to pass urine, needing to strain, having to go to the toilet again soon after you have just been, difficulty emptying the bladder, which is called retention. Many people experience a combination of storing and voiding problems. However, the good news is that these can be treated. Your doctor or nurse will discuss the wide range of treatment options with you. Some people need help to empty their bladder, and using a catheter is one way to do this. Your nurse or doctor will help explain the various catheters available. Some people use an in and out catheter to empty their bladder a few times a day. This can be challenging though, if opening your legs is difficult. Other people prefer a permanent catheter that goes directly into the bladder known as an indwelling catheter, or one that goes directly through the abdominal wall known as a suprapubic catheter. Bladder problems can make individuals susceptible to developing a bladder infection. Urine infections can occur in people with neurological conditions with or without catheters. Reduce your chance of developing a urine infection by drinking at least 2 liters of water a day. Other things that may help include pelvic floor exercises and bladder retraining, or using a prescribed antibiotic long term. There are a few things you can do to check if you might have developed a urine infection. Ask yourself a few key questions. Is there a foul smell? Has the color changed or become cloudy? Do you have a temperature? Do you feel unwell? So, if you notice that your spasticity feels worse than usual, it is always a good idea to check to see if you might have developed an infection before considering increasing your spasticity medication. Your spasticity team can help refer you to a bladder specialist. If you want to learn more about other trigger factors, please see Episode 1, Spasticity Overview and Management. Episode 3, Skin. Episode 4, Bowel and Summary of Spasticity Management. We hope you found this information useful. Thank you for watching this video. This film was funded by the National Brain Appeal, the charity dedicated to supporting the National Hospital for Neurology and Neurosurgery.